welcome to Mountain Health Today, brought to you by the Tahoe Forest Health System. Today we're going to be talking with Wendy Buchanan about customer care navigation and the Center for Health. Wendy, welcome. We'll be back in just a moment. We're back here at Mountain Health Today. I'm Ted Owens, your host. And my guest today is Wendy Buchanan. Wendy, welcome. You are the Director of Wellness Programs for the Tahoe Forest Health System, and we're going to be talking about customer care navigation and the Center for Health. Before we do, you have an important designation after your name, MS. What does that stand for?
I have a master's degree in exercise physiology. Okay,
that must have been quite a program. Yeah. And glad to have you here. Tell me, what is your role in the organization so the folks at home understand?
Yeah, so I am the Director of Wellness Programs, and that includes a few different departments within our hospital, the Cardiac Rehabilitation Department, as well as the Center for Health, and Tahoe Works Wellness at Work employer-based programming.
Okay, fills your week, I would imagine, pretty well. I know. So why customer care navigation?
Customer care navigation.
First off, let's talk about that. We use terms sometimes in the health industry like navigation, and that means something to you and I.
Yes.
But it doesn't to the folks at home. So
navigation was really designed to guide our local residents and area visitors through the Tahoe Forest Health System.
Okay, and then back to the question, why? Why customer care navigation? Is it important to us? Is it important to the patient, or both?
It's important to both. It's important to us because we really want to focus on patient satisfaction and to improve the patient experience through the Tahoe Forest Health System. And it's important that to our patients so they can connect to resources and find information easily.
And access to care. That's in a nutshell what you're talking about. Taking down the perceived roadblocks or difficulties to getting where you're supposed to be.
That's exactly it. It's access into care into the Tahoe Forest Health System. And there are perceived barriers around how to navigate through hospital departments and getting access to... Give
me an example of that.
Well, an example would be, let's say someone's going to have a total joint replacement at Tahoe Forest Hospital, and they want to find out information about the providers and the therapy and any of the programming that goes along with it. They could call our Customer Care Navigators, and they could tell them all about the community resources. They can provide information on the physicians, the surgeons, our physical therapy department, and the wellness programs that go along with it, so they can guide them through the whole process.
And expectations, start to finish.
Yes.
This follows this. And
yeah, so it's really a friendly voice that will listen to them, their fears, any concerns that they might have, and provide them with education and empower them through the process.
And you mentioned patient satisfaction, so how do you measure whether it's working?
Well, that's a good question. Really, it's just patients telling us that, thank you so much for helping me through this process. It's and we're working on some outcome measures around patient satisfaction surveys as well.
Now, when we talk about the Tahoe Forest Health System, it's not just the Tahoe Forest Hospital.
No, it's the entire health system. It's the whole system. It's Tahoe Forest Hospital, it's Incline Village Community Hospital, it's Tahoe Forest Physical Therapy, it's the Tahoe Center for Health, it's all of our community partners as well.
Now, one thing I've heard frequently, particularly when we have tourists that have to visit our system, is that they're a name, not a number. And do we aid and assist at all for the folks that are here visiting should they need our services, and can they find their way to a navigator? Yes,
absolutely. I mean, we can provide the resources to the departments that they might want to access, to give them information on all of our physicians in the area. And then a service that is special to the navigation is that we follow up with anyone that calls. We will follow up with them within a week to make sure they got the care that they needed and to see if there's anything else that they might have questions about.
And of course, they're providing information that helps you improve the navigation system if something was missed, or they think of something we hadn't thought of, correct?
Absolutely, yes.
Constant learning.
Yes.
So who would typically, or demographically, I guess is a good question, who typically is a user of the navigation system? What type of person typically will call?
It's really anyone. It's just a customer service that anyone who wants to access fitness programming, any of our wellness programming, which includes nutrition, stress management around mindfulness, kick nicotine, any of our chronic disease management programs out of our wellness neighborhood. Demographically, it might be more of our seniors or anyone who's going to have a big surgery, but it really could be anyone.
And the reason I ask the question is because I do things somewhat the old-fashioned way, which is why I think you answered the question the way that you did. But what about our younger members of the community, our healthier ones that might not be thinking about the services that we provide, but can they reach you too with the methods that they use, social media?
Yes. We have a presence on Facebook. We have a website, but our younger population, could use it just to access our wellness programs to stay healthy. So it's not always when you're sick, but it's how do I stay healthy and be mindful. And we have we have a medically based fitness facility, so there could be opportunities there that they might be interested in as well.
It strikes me as kind of a concierge type of a role.
Yeah.
But you're a connector. You're a connector to the needs of the caller or the person that's contacting you with a service or a provider or a program. How do you keep track of all the programs that might be available? Do they contact you, or are you constantly monitoring the?
We are constantly monitoring what's going on, but we do have a tracking system, and that's where our work is cut out for us, is keeping track of all the updated resources.
And that includes programs that may change, or or maybe it's a provider that leaves the area or something like that.
Yep.
Very interesting. Folks, we're talking with Wendy Buchanan about patient navigation in the Tahoe Forest Health System. You're watching Mountain Health Today. I'm Ted Owens, your host, and we'll be back in just a moment. Welcome back to Mountain Health Today. I'm talking with Wendy Buchanan about wellness programs and customer care navigation. Now, Wendy, I'm kind of your average Joe, and sometimes healthcare lingo can confuse me. So, for the folks at home, we were talking about patient navigation and all of those. You're the connector to a variety of services and providers and what have you. But how easy is it for someone at home to get involved? What's the first step?
Okay,
is it a phone call, internet, all of that?
Yes, it's really easy. And
is it intimidating?
It is not intimidating.
I'm very concerned about that part.
So navigation is a free service that anyone can call. It's 530-587-3769, and our navigators will answer the phone, and all you have to say is, hey, I need some help. I'd really like to lose some weight, or I think I might need to have something done with my knee. Like, where do I even start? And so we would start with getting some demographic information, but then finding out who your primary care provider is. We want to connect you back to your primary care provider. If you don't have a provider, then we can provide the resources on how to access that. And then we'll give you some resources around our fitness and wellness programming that we have, asking appropriate questions around whether you prefer groups or individuals. And we have a lot of free programming available around nutrition and stress management and exercise as well.
So you've said free, and that's very important, and that perks up my ears. Healthcare is expensive.
Yes.
And so anytime you can achieve any kind of a benefit, including navigation for no cost, I think that's wonderful. But do you get cost-related questions?
Well, we're not
healthcare?
Financial assistance, but we do have a financial assistance department at our hospital that we can navigate you to.
Okay, that's what I was driving at.
Our services are free, and we're just information. We're a resource to connect you and guide you to providers and departments and whatever you might need. And then, the most important thing is that we follow up with our phone call to make sure that you got what you need, and if you have any other questions. But it is a free service that anyone can call. We're open 7 days a week, and we're just information.
In this day and age, following up is huge. Do you get feedback, positive feedback for following up?
Oh, absolutely. People will say, wow, thank you so much for calling. You know, I really feel like you care.
You know, and that's important. Let's talk about that for a moment. Who are the navigators? You know, very often when people make phone calls like this,
Yeah.
In their mind's eye, they want to have a vision or an understanding of who they're talking to. So tell me, who are they?
They're just a friendly staff, but the navigators are hired and work at the Center for Health at Tahoe Forest Hospital, and they're trained with motivational interviewing skills, which is a big term, but basically they're trained to listen. They're trained to listen and ask open-ended questions around what you need and what you're looking for. We're not there to tell you what to do, or we're just there to give you information and to guide you into what you would enjoy and what the best, how can you achieve your best self.
So there's some training involved, but those kinds of folks are special people. Not everybody wants or can do that type of work.
Yeah.
So you're not training them to put on a show. These are truly kind people that this is their aptitude.
Yes, absolutely. I mean, it's customer service. It's being able to talk to anyone and to guide them and help them.
And 7 days a week?
7 days a week.
What are the call hours?
Yeah, we're open Monday through Friday, 6:30 to 6:30, and Saturdays and Sundays from 8 to 4.
I think that also in this day and age to be able to provide that service on a Saturday and a Sunday is a big thing.
Yeah.
Let's talk a little bit about gaining information on fitness and wellness programs. And the reason I want to do that through navigation is the Tahoe Truckee region, very healthy generally speaking. People are engaged in recreational activities, skiing, snowboarding, and then of course the summertime rock climbing, mountain biking, and what have you. So you're there for those folks as well, people that might want to improve their wellness, get more active, things of that nature. Do you take many calls from that category?
Not as many as around the chronic disease management or around people that just need help with stress management and that types of things. But absolutely, I mean, we are housed with the Tahoe Forest Physical Therapy Services, and so there's athletes that are there rehabbing their injuries, and we can assist them in their wellness on their orthopedic continuum of care by offering personal training and other services that can help their whole self around nutrition and just their mental health as well.
But they can call you, for example, even if they have a tick or something that they do or something that hurts. So you get to be my age, that could be getting out of bed in the morning. But folks like that can call and be navigated to primary care provider or a specialized provider. So you kind of walk them right on through into
whole
where they
continuum
need
of care.
into where they need to be.
Yeah.
Okay, now you've mentioned the center a
Yes.
couple of times, and I know that's kind of how we refer to it locally. But it's the Center for Health. What is it?
The Center for Health is a medically managed fitness center and wellness center. We've transitioned over within about the last year, so we're not necessarily a gym, but a place where people can go to have medically managed fitness, which is communication with their provider, communication with their physical therapist if they're there for physical therapy, and for some sort of special need around chronic illness or any sort of individual specific reason.
Now, you said that you're not a gym. For example, my wife goes to the center for very specific reasons because of very specific programs that you provide.
Yep.
You mentioned mindfulness, for example. I go to a gym, but I talk too much. So that's why I go to the gym. But it's a calm environment that you have with a multitude of programs, yoga, all kinds of things, correct?
Yes. So it's supervised exercise. We have group exercise classes, but all of our classes, they're different than going down the street to a gym where you can go work out and put your headphones on, but it's specialized, highly trained instructors that can modify and can help you for any special needs that you have. We have nutrition programs. We have several registered dietitians on staff. that can do nutrition consults around weight loss or anti-inflammatory diets or any sort of nutrition special needs. And then
explains why my wife
yes.
goes.
And
we're
then on the
going to have to wrap up for just a second. We're going to come back to this because I'm going to want to talk about it. We're talking with Wendy Buchanan, Tahoe Forest Health System, and we're going to be talking a little bit about mindfulness in just a moment. I'm Ted Owens. We'll be right back. Thank you for watching Mountain Health Today. I'm Ted Owens, your host. I've had a wonderful conversation with Wendy Buchanan from the Tahoe Forest Health System talking about wellness programs. Thanks again for watching, and we hope to see you on a future episode.